Well, we've lived through a lot of history together. This pandemic, the worst healthcare crisis in the history of this nation in the last century. So much has happened here, so much unprecedented, and so many firsts. And this has been a crisis filled with historical firsts. And we are being challenged in this moment like never before. But some of those firsts really speak to what New Yorkers have achieved together. Obviously, we've never had to do social distancing like this in our entire history. It's unheard of, and yet, you've excelled. You really have at finding a way to do it. We've never had to make our own personal protective equipment, our own ventilators. We've never had to even think that way before, and yet New Yorkers have stepped up, companies have come forward. It's been a remarkable and successful effort. We never had to imagine being unable to depend on our own federal government and needing our own New York City strategic reserve of PPEs and medical supplies and equipment, but now that's what we are building because we know we have to protect ourselves, and we know we need the ability to produce our own supplies and equipment right here in New York City. These are all firsts. They're not necessarily firsts we ever would have wanted, but they're firsts that say so much about New Yorkers and our capacity to fight back and to adapt to any situation. Now, throughout this crisis, we've said the thing we've lacked from day one, the thing that would have been the difference maker in the beginning and still can be the difference maker if we got the help we needed from the federal government, be testing, testing, testing. Testing is still the core to everything. And while we're still waiting for all the help we need and deserve, another first, building our own test kits here in New York City. These test kits are the way we collect the samples from each New Yorker. This is something we would have had to depend on supplies from not only all over the nation, all over the world previously, and now we're making them right here in New York City. So our remarkable team at the city's Economic Development Corporation got together, and I said to them from the beginning, throw away the rule book, throw away the assumptions. Even if we haven't built things here, find a way to make them right here in New York City. And to the credit of everyone at EDC, they took up that mission immediately. No holds barred, no hesitation. They had a can-do spirit. I want to thank everyone at EDC and all the companies, all the academic institutions, the hospitals, everyone they've partnered with in New York City and beyond to achieve these goals. But from the beginning, it came down to where would they find the partners who could make this happen? How would they find the materials? How fast could they do it? And my clear demand of the Economic Development Corporation was do everything, do it well, do it in an unprecedented manner, do it fast. And that's what they have been doing. So a dream team has come together from all over New York City to make things happen. In the case of test kits, this is the essence of what we need, and this team that's come together is going to help so many New Yorkers and help save lives of the people of this city. Who are they? Well, when it comes to making the swabs, and that is these things here in their nice protective package, the swabs, that comes from Print Parts, a company in Manhattan. The transport medium, that is the fluid here. That comes from the team at Albert Einstein College of Medicine in the Bronx that worked to get that right, because the transport medium holds the sample and makes sure it is safe and sanitary and can be accurately assessed. A company called Collab in Brooklyn helped provide the design to put together the kits the right way. So these pieces came together here in our city, things we would have depended on companies from around the country, in many cases outside the country to produce, now produced here for our people. So for the first time in our history, New York City is building and using its own test kits, homegrown New York City products protecting New Yorkers. Now, as of this very day, for the first time, the Made in New York City test kits are in use at health and hospitals community testing sites. And this is a beginning today. But by the end of the week, more than 60,000 of these test kits will have been delivered, and be in use. And then we're ramping up from there. The production process is speeding up every week. So last week, 28,000 kits produced. This week, 33,000. In the week of May 25th, 50,000. The week of June 1st, over 60,000 of these test kits will be produced each week in New York City. That is more than the original projection of what could be produced weekly. And we'll keep going as far as we have to go to make sure that every New Yorker who needs a test gets one. And remember, this is not just about the test kits that are being produced right now for all of you to use now. This is about building capacity in New York City to produce whatever we need in the future to fight this pandemic and anything else that's thrown at us. This is about building the capacity to produce right here and to protect ourselves. Now, we have to do it because we learned we could not depend on the federal government. We had to do it because we saw the entire international market fall apart before our very eyes. And it was shocking, honestly, in the beginning of March to see supplies that we had depended on previously suddenly evaporate. We had to do it to make sure that we could have our own reliable supply. And nothing's more reliable than what you build right here in the 5 boroughs. So as I said yesterday, we're now at 20,000 tests per day capacity in terms of our labs and our ability to test out in communities. That's going to grow steadily. And having the test kits to go with it keeps building this whole plan out. I talked about yesterday the fact we're adding sites for testing. We're adding members of our new tracer corps. All of the pieces, the test kits, the test sites, the labs, the tracers, all of these pieces are coming together to give us the huge, robust test and trace program we need to push back this disease and move forward in this city. Now, constant growth from this point on, so more testing sites. We have the kits, now we need more sites, 2 more health and hospitals test sites open today in communities in the city, 1 in Washington Heights, 1 in Midwood. That brings us to 25 total health and hospital sites. On top of that, 5 One Medical sites. That's a private provider working with Local 1199 SEIU. And as I announced yesterday, 123 City MD urgent care sites now, all providing testing to New Yorkers. Added up, over 150 test sites now in this city. Remember, just a few weeks ago, we didn't have grassroots testing. We were fighting just to keep our hospitals going. Now over 150 sites, and that will keep growing steadily. To find a place where you can get tested, go online, nyc.gov/COVID tests. And everything I referred to here, these kits, again, this is the diagnostic testing, or otherwise referred to as PCR testing. This is to tell you if right now you have the coronavirus. The other kind of testing is important too, the antibody testing, which helps you understand if you've been exposed previously to the coronavirus and obviously proves your ability to fight your way through it. So in the coming weeks, 2 big initiatives that are starting now, and they'll build out 140,000 antibody tests will be provided to first responders and healthcare workers, and then 140,000 for everyday New Yorkers on top of that, combined well over 250,000 antibody tests. This morning, our antibody testing program for our first responders and healthcare workers began. And it will run for about 4 weeks. This is in coordination with the federal government, and I want to thank everyone at the Department of Health and Human Services and the Centers for Disease Control who came to us with this proposal. We worked together in partnership. They are covering all the appropriate costs. So this is something that's being provided for free to first responders and healthcare workers and not being charged to the City of New York either, so that's a very good thing. Again, every individual will get the results. That's good, but on top of it, it will help us understand what's happening with the disease more broadly. So it's part of a bigger study to help us learn how to fight this disease better. So 140,000 of our heroes will get tested. It's voluntary. It's up to each of you, first responders, healthcare workers. If you want it, it's there for you. Now, it will start with FDNY, with EMTs, paramedics, firefighters, the whole FDNY family. Anyone is welcome to participate. Testers will go to your work sites. Same with the OCME staff, medical examiner's office. Those will be the first agencies reached. You can sign up to get your test right away, and then we're going to reach more and more of our first responders and healthcare agencies over the coming weeks. To sign up, you go to firstserosurveynyc.com. Yes, it's a mouthful. First, S-E-R-O, surveynyc.com, or text test NYC to 78378. So we're really happy that that's up and running. That's going to give a lot of good information to individuals who have served us so well and also help us all to fight this disease. Now, turning to a topic we've been talking about for the last couple of weeks, and it is a very sober and painful topic because it involves a threat to our children. And I say every time I speak as a parent, I understand what all parents and family members feel when they feel their children may be threatened. This reality we are taking very, very seriously. Now, what we've been calling it, and the health department defined it with a simple phrase, it's not a short phrase, but it captures what we've seen, pediatric multi-system inflammatory syndrome, PMIS. That's what we have called it, and that's what our health team has been working every day to understand, working with pediatricians, hospitals, healthcare providers all over the city. Now the Centers for Disease Control federally has released some key updates. I want to share them with you now. First of all, important, what they are calling this new reality. CDC is now calling it multi-system inflammatory syndrome in children, MISC. So we will, from this point on, refer to it also as MISC for consistency with the federal government. The CDC has confirmed a link to COVID-19. So this is important. We've assumed it, but they have done additional research to 100% confirm it. And they've released a standard national definition so that the whole country, doctors, scientists all over the country can share information, common definition, and we can all work together to understand how to fight this back. Now, again, we'll call it MISC. We'll work with the CDC, we'll work with the state, we'll work with other jurisdictions around the country, everyone sharing information to figure out what to do to fight this. The health department is now taking the CDC's definition and applying it back over the last few weeks to see what it tells us about the cases that we have seen so far. And we want to give additional guidance to parents and family members because there's some additional information that will help you identify symptoms and act quickly. And I'm going to always say it, early detection matters crucially. Alerting a healthcare provider if your child needs to get to a healthcare facility quickly. These things have to happen with real speed to make sure children are safe. So it begins with, since it is linked to COVID-19, you've got the immediate point that everything else we do to fight the coronavirus, we need to do to fight MISC. So that means the hygiene, the washing hands, the hand sanitizer, the coughing into your elbow when you cough or sneeze, all the basics, using the face covering, staying home to the maximum extent possible, social distancing, all of this helps make sure our children are not exposed to this disease. And that's the best way to avoid this challenge because it keeps COVID out of the equation. Now, the symptoms. We've talked about several of them, but I want to add, because the CDC research and definition has added additional symptoms to the equation. Persistent fever, irritability or sluggishness, abdominal pain, diarrhea, vomiting, rash, conjunctivitis, which is shown as red or pink eyes, enlarged lymph node gland in the neck, red cracked lips or red tongue, and swollen hands and feet. So that's a lot to be aware of. Any of those symptoms you see in your child, call your healthcare provider, check in immediately. If you see multiple symptoms, especially important to get your doctor, your healthcare provider immediately. If you don't have one, call 311 and you will be connected to a health and hospitals clinician immediately. Now, right now, the number of children affected The previous definition we used was 145. Under that definition, we've confirmed 145 kids affected. 67 of those cases tested positive for COVID-19 or had antibodies. And we did lose one child. And again, our goal is to never lose another. We'll have updated numbers with this new definition, the MISC definition, shortly. But the bottom line is the additional news, the additional information from the CDC allows us to hone our approach more, but the same bottom line. Look for these symptoms in your child. Act quickly if you see them. If they get to healthcare quickly, children can be brought through this safely, and that's what we all need to do together. Okay, so that's the part of my presentation that really, again, that hits me like every parent, like everyone who has children in their life. So I'll come down off of that and we'll move to topics that are a little more mundane, to say the least, but things that still matter to everyday New Yorkers and our quality of life and what we deal with every day during this crisis. So one of the things that's been truly different, neighborhood by neighborhood in this city, is that alternate side parking has been suspended for the past 2 months, one of the longest suspensions in the history of this city. And it worked because it helped people stay inside and not have to deal with the hassle of moving their car, but in more and more areas we start to see litter accumulating as more and more people have been out, and obviously a long time has passed. So we want to do for 1 week a clean sweep. We want to do for 1 week a cleanup of all neighborhoods in the city. That done right allows us to then cancel alternate side again for a period of time, and hopefully for a long period of time, so long as we see that our streets and sidewalks remain clean. So as of today, alternate side parking is back into effect just for this week, from today through Saturday, May 23rd. There is an exception this week where it's suspended on Thursday for Ascension Day. So basically, Monday, Tuesday, Wednesday, and then Friday, Saturday, and then it goes off again. The next period of time will be 2 weeks. For Sunday, May 24th to Sunday, June 7th, no alternate side parking. We've decided that in advance, so you can bank on that. We'll keep reevaluating then in the beginning of June, see where we stand. Hopefully, everyone work with us. Please remember how important it is to not litter as per usual, but if we can keep everything clean, we can keep canceling alternate side in the future for long periods of time. But right now, alternate side back in effect today through Saturday, with the exception of Thursday off for Ascension Day. Okay, we're going to our daily indicators now. Again, we've had overall trend fantastic, but a lot of days that are mixed bags. We've got a mixed bag day today. It's a good day on one indicator, mixed on the others. We still keep making progress overall, but I want to inspire everyone, go deeper. The faster we can get through these indicators, the more thoroughly we can consolidate our success, the more chance of starting to relax restrictions. So we all got to stick with it here. So indicator 1, daily number of people admitted to hospitals for suspected COVID-19. That is down, and this is a great one, down from 77 to 48. That's amazing. Now, under 50 people admitted to the hospital in a day for COVID-19. That's a really wonderful sign. But the number of people in ICUs across our public hospitals for suspected COVID-19, that went up just a little from 469 to 475. So it's not a huge increase, and I keep that in mind, but it's still an increase. We need it to keep going down. And then the percentage of people tested positive for COVID-19 unchanged, 11%. Again, overall, good news because of the overall direction, great news on the number of people going into the hospitals, but we need to create that steady progress to get to the next stage. Few words in Spanish. Esta crisis es la primera de su tipo, y los neoyorquinos deben sentir orgullo por lo que hemos ganado juntos. Por primera vez en la historia, estamos creando nuestros propios exámenes de coronavirus para que los neoyorquinos tengan las respuestas que merecen. Y vamos a seguir, vamos a hacer más exámenes y le vamos a seguir el rastro a este virus hasta que se gane esta lucha. With that, we will turn to our colleagues in the media, and please remind me of the name and outlet of each reporter.
Hi all, just a reminder, we have President and CEO of Health and Hospitals, Dr. Katz, President and CEO of the EDC, James Patchett, and Senior Advisor, Dr. Varma, on the phone. With that, I will start with Steve from Westwood One News.
Good morning, Mr. Mayor. Hope you had an enjoyable weekend when you were able to away from work for a moment. I suppose you had some downtime. I hope you did.
Thank you, Steve. I appreciate that.
I suppose you don't have much downtime at all, but even a few minutes helps, I suppose, right?
Exactly. We'll take whatever we can get.
Exactly. I have two questions. One is about non-essential workers and the decision-making process for when it might be possible for them to return to work. You have companies like Google, Facebook, and others extending their work from home for their employees until the end of the year. It seems like you've been looking at this issue on a month-to-month basis, but it's always helpful and appreciated when people have an idea of when things will change so they can plan for it over the long term. So what coronavirus indicators are you looking at, and what goals do you want to see reached before you consider allowing non-essential workers to return to the workplace? And will you perhaps follow Google and Facebook's lead and tell city employees who can perform their duties from home to continue working from home through the summer or maybe even later? That's an important decision since so much of the private sector will follow the city's lead. And then my second question, the New York Stock Exchange officials said when they reopen the trading floor, they're going to encourage all returning workers not to take mass transit. How concerning is that? Do you support such an idea, given that it would likely create considerable traffic issues if many private sector corporations issue similar directives? And should it fall upon those employers to provide some sort of alternative like commuter vans and private buses?
Great question, Steve. Okay, so let me try the simplest big picture. Right now, we just went over our daily indicators. The state has its 7 indicators, 3 New York City, 7 New York State. To get to the point of even the first opening up, the first set of restrictions relaxed, we need to hit all 3 of the city indicators. That means 10 to 14 days of steady progress in all 3. And we need to hit all 7 of the state indicators. And we have to be confident, just to make it just a little more rigorous, we have to be confident that we'll be able to hold at that level. My job is to be really blunt and honest with New Yorkers that when I think we can handle the first elements of relaxing restrictions and hold that position and then move forward to the next point where we can relax more restrictions, that's the time to do it, when you believe not only have you hit the indicators, but that you can make it work and avoid that boomerang. The last thing in the world we want is, hey, take off some restrictions and immediately have a problem, put the restrictions back on, or even in some places they've gone and had to add more tougher restrictions. So we're constantly trying to get it right, and I believe it's a cardinal rule that our goal is to get it right the first time. We're not going to have a perfectly straight line, Steve, where everything always goes exactly the direction we want. That would be kind of superhuman. But we cannot have a boomerang. We cannot have something where we have to shut down again. So we're going to be really smart and careful about it to get it right. And I guarantee you, if we can hit that note right, it'll save us so much time and energy going forward to not have to start and then stop and then start again. So that's the underlying viewpoint. Very simply, that says, well, first of all, there's no way we're getting to the city and state indicators before June at this rate. So June's the first opportunity. First half of June is the first opportunity to relax anything. States talked about some of the vision of how that relaxing would look. I'll be filling in those blanks in the next week or two before we get to a point of any decision, so New Yorkers will have more and more sense of what that first few steps might look like. For now, definitely, we have to think about most non-essential workers, of course, are going to keep either working from home or not doing the work they've done until we get to a point that's safer. So the basic dynamics we have now are going to hold, If there's some loosening up, it'll be in some key areas, but we're not opening up the floodgates at once. We've seen other places do that, and they paid dearly for it. So this will be in stages. City employees who right now are working remotely, most of them will continue to for the foreseeable future. But again, we will lay all this out in stages as we are ready. I think everything's going to be interrelated to the reality on the ground. I think obviously we all want to know, will there be a vaccine and when, or will there be elements of treatment that start to work consistently? That's going to change the whole equation. But based on what we know now, we would be careful and slow and maximize remote work for the foreseeable future. As to any company that urged its employees not to use mass transit, well, some of that isn't surprising to me, and some of that people will do on their own until they feel safer. But you're right, we have to be careful for the opposite problem. If everyone starts turning to cars, that will create a whole new problem. It is a legitimate point that companies should think about ways of creating alternatives to get people around in the meantime. I think that's a very productive thought. But I think we're all yearning for really, really, really clear answers, and we'd all like to be able to see exactly what's going to happen. I think we have to be patient about the fact that we're going to learn day by day what's real, and when the answers are there and they're verifiable, that's when I'll offer them to people. Big picture, I want to get us safely through this summer, some opening up as we go along, and then September, crucial. Opening schools, I want to see if we can get it open the whole way, the way they are typically, and that's a real natural point to start opening up more if all goes well, because that's when everyone normally would come back from the summer and sort of go into high gear. So I hope that gives you a flavor of it, but it's going to be day by day, week by week.
Next, we have Alejandra from AM New York.
Hi, Mr. Mayor. Can you hear me?
Yes, Alejandra, how you doing?
Good, good. How are you doing? I just had a question. Over the weekend, you said that if need be, the city would put up fences along beaches to help prevent overcrowding. Can you talk a little bit about what that would actually look like, what those fences would look like, how practical that might be? I mean, there's a lot of beach front in this city.
Yeah. Well, people will start to see the initial work. I mean, it's going to begin today to put the fencing in position. I don't want to activate it, I don't want to implement it unless we need to, but we have to have it ready. So what I can tell you is my goal, I keep saying it to people, is folks from the surrounding communities near our beaches, and that's a lot of people, hundreds of thousands of people in this city. If you want to walk on the beach, fine, enjoy that, but no swimming, no lifeguards, no parties, no barbecues, no sports. It's just open space that you can walk on, take it in, and then get back home. But if we see people start to turn it into something like what happens in a traditional summer with beaches, we'll give a few warnings for sure to the people of this city and to the people of the communities near the beaches that, if we don't see the right thing, we'll have to be stricter. So the fencing will be in position and ready, but it won't be put up initially. If it did have to be put up, it would simply cut off all the entry points to the beaches. I don't want to do that. It's not something I want to see happen, but this is about health and safety. Everything's about health and safety first. So if we need to put up fencing, we will. But I'm giving people every chance to still enjoy what they can about the beach without going to the point that we have to take tougher measures.
Next, we have Katie from the Wall Street Journal.
Good morning, everyone. My question is, I had asked it last week. I just wanted to check on an update because I've seen a lot of people asking about it. Just more information and data. I know Dr. Barbeau isn't on the call again. Hope she's okay. But I'm curious if the Department of Health in the city will release the deaths per zip code. I know that's been a piece of information that you said that we should receive. So I wanted to get an update on that. And
yeah.
If Dr. Barbeau will come back on the call. Thank you.
Thank you. Deaths per zip code, that is coming out very soon. We'll get to the exact day, but definitely coming out soon. And again, we do the daily lineup according to what we need for that day. So we put out a lineup of folks who can respond to the issues, and that's what we'll do every day. And I've been handed a note, the deaths by zip code. Again, sorry to be talking about such a sad topic, but we are at this point trying to make sure there's transparency, obviously, even including about painful things. That will come out this afternoon.
Next, we have Marcia from CBS.
Mr. Mayor, good morning. How you doing?
I'm doing well, Marcia. How are you?
Thank you. So my questions today have to do with the city's food program. We've received a number of complaints from people who say sometimes the food arrives rotten, moldy, not properly sealed. Sometimes the deliveries are sporadic. And one couple said that their last delivery included, and I want to quote, 6 bags of onion rings, potato chips, and cookies, and that was it. I wonder if you think that's acceptable and if you think that there should be tighter controls.
Unquestionably, Marcia, I'm counting my blessings in the middle of this crisis, and it is a blessing anytime you or any member of the media points out something that needs to be fixed on behalf of the people of this city. So thank you. No, of course not. Onion rings and cookies are not nutrition. We may all enjoy them, but that ain't nutrition. So I want to get all the details to my team, please. Whatever you have of where that's happened, we'll go and fix it. Anything that's not quality food, that could mean, not nutritious, and that could mean not food that's up to date. It's unacceptable. We're putting a huge amount of time, energy, and resources into getting this right. So if any vendor, any company is giving us food that's not the right quality, we're going to go after them. If anybody in our administration isn't making sure there's high quality food, they have a problem with me. We're going to work on this and fix this. Overwhelmingly, Marcia, I've heard from community leaders, elected officials, clergy, how much they appreciate the food program, how much they've heard from their constituents that they are benefiting from the food program, particularly the deliveries to the door of folks who can't get out, seniors and folks with disabilities and folks who really need those direct deliveries. So overwhelmingly, I want to say I think it has been a success. And I give credit to our food czar, Catherine Garcia, and her whole team and all the agencies that have been involved. But if anybody anywhere has fallen down on the job, we want to know about it and we want to fix it right away.
Next, we have James from Pix 11.
Mr. Mayor, can you hear me okay?
Yes, James, how you doing?
I'm doing okay, thank you. I hope you're well and the week is getting off to as good a start as possible.
Possible, that is the right word for it.
Look, the COVID tracking center is saying that in some jurisdictions nationwide, there are more tests than there are people signing up to take them. I'm curious what those numbers look like here in New York City. Do we know what the demand is versus the supply, and how is that being tracked here?
It's a great question, James. Remember that for a long time, we had nowhere near even the beginning of a testing supply to be able to reach people. So we sent a very conservative message. For a long time, there was no testing. Remember, it goes back to January 24th when I first asked the federal government to give us the local ability to test and to provide us testing on a large scale, and we've still never gotten it. That's January 24th till now. We're coming up on, the 4-month anniversary of that. It's unbelievable. But when we finally got some testing, we were very conservative about it because the supply was so limited. It was focused on the folks whose lives were in immediate danger in the hospitals. It was focused on protecting healthcare providers, focused on protecting first responders, so those folks could continue to protect all of us. And only in the last few weeks have we been able to go out to communities and start to do community testing. But remember, the initial focus was on older folks, much older folks, and folks with pre-existing conditions, and particularly those who had both. What we said in the last few days is we're opening up those criteria further. We want to reach a whole lot more people, particularly folks, anyone symptomatic we want to reach, anyone who's been around others that are symptomatic or tested positive, because we're finally getting the kind of capacity we need, but not because we got help where we expected to get it from in Washington, because we created our own, and because the labs have been helping us to get more and more capacity. So every time we increase the amount of available testing, it gets taken up quickly. There's a little bit of lag in the beginning as people get used to it and learn the places and all, but it quickly, when people understand there's a testing site available, it's free, and that they're allowed to go there, they fit the categories, people take it up. So I think we're going to see a whole lot of take up on this. I think New Yorkers are hungry to get these answers and obviously understand that when people get tested, it's part of the bigger strategy of beating back this disease. So I like what I'm seeing, and I'm confident as we have more and more and let people know it's for them and it's free, that more and more people will come.
Next, we have Henry from Bloomberg.
Hello, Mr. Mayor. I hope you're doing well. My question has to do with the city's compliance with the state's metrics. I'm looking at the 16th, May 16th, the city was in compliance or had achieved 3 of 7 of the metrics. So I'm wondering whether this indicates whether the city is really kind of stuck in a position where it's not really moving forward. I mean, where do you see progress here in terms of the city meeting the state's metrics?
Well, I'm looking at them now, Henry. Look, we clearly are making progress. There's several we've met, as you said. And on the others, there's been clear progress, for example, on the number of available hospital beds and number of ICU beds. Those are 2 areas where we need to go farther, but we're getting close to those goals. And I think there's a point in the first half of June when we'll meet those. The number of contact tracers, we've made very clear. We expect to hit that goal in the beginning of June. Obviously, other parts of the state are working hard to catch up on their own version of that goal. We're confident we're going to get there, given the number of contact tracers we're bringing on regularly. So you can't guarantee anything in life, but if you're watching the trend lines, Henry, both on our city indicators and the state indicators, both will align in the first half of June. But again, we've got to then make decisions on exactly which restrictions to loosen up, exactly how, and we have to be confident that when we're doing it, we can hold the line. We do not want to reduce restrictions and suddenly see an upsurge that puts us right back in a situation where we have to close down. So there's a real subtle balance that needs to be struck. But if the question is, do we believe we'll meet all 7 state indicators? Yes. When? First half of June.
Next, we have Juliet from 1010 Wins.
Oh, hi. Good morning, Mr. Mayor. How are you doing today?
I'm doing well, Juliet. How are you?
I'm fine. Thank you so much. So 2 questions. Back to the beaches. I'm sure you're expecting people to turn out, even though you're talking about just people in the neighborhood to come. But what are the specific crowd control plans for people arriving to the beach? Will the fences definitely be up? Will it be police barricades to that effect? Will there be limits to who can get to the beach or on the boardwalk? And the second question is, the city budget includes anticipated raises for teachers, police, et cetera. Given the costs of battling this virus, are you considering a freeze on proposed pay increases?
Okay. So on the beaches first. So the fencing, again, available, but we don't want to use it if we don't have to. When you put up the fencing, you're talking about cutting off access to the sand across the board. Don't want to do that if we don't have to do it. Fencing will be there if we need to implement it, but my goal is to see us not have to implement it. Remember, Juliet, this is how we start. Normally beach season begins on Memorial Day, so in a week. And what's quite clear is we're not in a position to start now. We just talked about the state indicators, the city indicators, by every objective measure. We're not there yet. That does not rule out that later in the beach season we might, do well enough and show enough progress to do something different. Still with some real restrictions, and you've seen the state restrictions on beaches everywhere. There's a whole lot of things that will not be allowed at any beach in the state. But, we're holding out the hope that at some point we could open up, and we're training the lifeguards and we'll be ready. But we have to be ready to go up or down the scale depending on what's happening. So the fencing will be there. but it won't be implemented at first. We're hoping everyone just listens to the rules, follows the rules. No swimming, no sports, no gatherings, no parties, just common sense, observe social distancing. If you walk on the beach, do it for a limited period of time, get back home like everyone else. In terms of enforcement, NYPD will be out, Parks Department will be out. Obviously, first and foremost, to help make everyone remember, don't go in the water. You're not supposed to go in the water. It's a dangerous situation to ever go in the water when there's not lifeguards present. So there'll be a constant reminder of that. If anyone tries to get in the water, they'll be taken right out of the water. So we want to keep people moving. We want to make sure nothing gets too crowded. Don't want to see the boardwalks crowded. Just classic social distancing. I guess I shouldn't say classic because it's something we've only dealt with for a few months, but it feels like it's been a long time. We understand the basic concept of social distancing and crowding, and the NYPD will always work to avoid crowds and gatherings. So they'll be out, and Parks Enforcement will be out. But we're not putting up police barriers or any of that stuff initially, because the message to people is it's not beach season. Meaning we're in a different reality. We're in a pandemic. We're in a global health crisis. It's not beach season like normal. So don't go to the beach. If you live in the surrounding communities, and you're used to just going for a walk on the beach, that's one thing. But don't travel to the beach, because we don't want to create that dynamic where people do non-essential travel on subways, on buses, which is normally how so many people get to the beach. We're not doing that. Let's keep it simple. But Juliet, we will, if we need more enforcement, we'll put it there. If we need to take tougher measures, we will. And if conversely it goes really well and people listen to the rules, we'll keep things more open. And then maybe, let's pray, we get to the point later on where we can open up things more and maybe even have part of the beach season again. On the city budget, we've got a stark choice ahead, Juliet. Our goal always is to help working people. This is what I came here to do. I don't want to take away from working people. I want to protect people's livelihoods. I want to protect their income. And if I get the help that we all deserve from the federal government, we'll be able to do that. This city's been the epicenter. I mean, I don't know what some people are thinking in Washington. This is the epicenter of the crisis for the whole nation. We also are one of the key places in all of America for sparking and building the entire American economy for the good of all. And if we're back on our feet and if we're unable to provide basic services and we can't get the job done, there's not going to be recovery here. And I think in that case, it will hinder recovery everywhere else. So it all comes down to the stimulus. If the stimulus is the right kind of stimulus, if it's done in time for our budget in June, we're going to move full speed ahead to provide all the services we provide, have the personnel we need, provide people with the incomes they deserve. If there is no stimulus in time or it's nowhere near the amount we need, then a whole series of really tough decisions will have to be made across the board, affecting all agencies and all personnel in a variety of ways. So we're not there yet, but in that instance, everything will be on the table. But let's accent the positive. Let's go fight for the stimulus to be the right thing, the thing it should be, and that's what will allow us to support our workforce and support a strong recovery here.
Next, we have Julia from the Post.
Hey, good morning, Mr. Mayor and everyone on the call. 2 questions. The first, Mr. Mayor, I'd like to get your reaction to an article on today's cover about out-of-state nurses who were brought in to help the city run the adult daycare center on Roosevelt Island. They told us patients had horrific bed sores, unchanged diapers. There were even feces smeared on the walls. So your reaction to that. And then a second, little bit unusual question, but I know you went to high school with Patrick Ewing. I wonder if you watched the Last Dance series and what you thought about it. If not, what have you been watching as an escape?
I did go to high school with Patrick Ewing. He was 2 years behind me in high school, and I used to think I was tall until the day I was walking down the hallway in high school and Patrick Ewing walked by for the first time. And definitely my ego has never recovered since. And he's an amazing player, an amazing person. I have not seen that series though. So what Charlene and I do is we tend to latch on to one show and see it through. And for a few, I don't know, 6 months or a year ago, we went through The Wire, which we had watched originally. We went through it again, the whole 5 seasons. We went through Treme, the whole, I think it's 4 or 5 seasons. Then I've been public about this fact. I don't have to always be high-minded. We did Empire. We watched all of Empire. Not always the most high-minded show, but in many ways a very intriguing show. And now we are watching Billions, which we never watched when it first came out. So we're going through that from the beginning. An incredibly well-acted and well-written show. So that's where we part of the day get to take our mind off of something. On this very serious and this very, when you think about the situation at Kohler, and I have not read the article, Julia, but I've had it summarized to me. I think about the human reality, which is any senior who's in any facility. These are our elders, these are our family members, these are people who deserve the maximum respect and the best care. Now, it's important to note, and we'll get you all this background, Kohler is a very well-respected institution. It's been recognized nationally as a quality senior facility. Recent inspections were favorable. There's a lot of very positive things that historically we've known about Kohler. If something went wrong in the middle of this crisis, I want to get to the bottom of it. So we're going to investigate what happened here. I've talked to Dr. Katz. We are shoulder to shoulder, and we want to know exactly what happened. So H&H is going to do its own investigation. If the state is investigating, we're going to absolutely work with them. We want to get down to the bottom of what happened here. Anybody with information should come forward. So it's important that these nurses come forward to our investigators and the states. I'm glad they talked to you because we want all the truth to come out, but we need them to talk to our authorities and the state's authorities. And if it's proven that anything like that happened, that's unacceptable. Yes, it was in the middle, from I understand the timing, the worst moment of the COVID crisis. Our systems were overwhelmed. There's a lot of staff out. Things were in real tough shape for everyone in every facility that handled healthcare. But still, if something happened that shouldn't have happened, there has to be consequences. It has to be dealt with. So we will do that for sure. But again, this facility historically, as recently as October, Newsweek ranked the Kohler Senior Nursing Facility as the 5th best in New York State. And the most recent state inspection was November and was positive. So, if something went wrong, we want to know exactly what it was. We want to find the exact individuals who are responsible, and then there, of course, will be consequences. And much more immediately, we have to make sure that everything now, the care there is the best it can and should be for every person there, and that there's nothing like that happening anymore.
Last 2 for today. Next is Andrew from NBC.
Good morning, everybody. Happy Monday. Mayor, I wanted to ask about schools. Last week, you and Mike Mulgrew didn't seem to be on the same page about the timeline for making a plan for the fall. He said that the teachers need to know within 2 to 3 weeks whether the plan is full reopening, hybrid reopening, or online learning. So I'm wondering, are you closer to making a decision or a recommendation on schools? And also, have schools been complicated by the emergence of this child inflammatory syndrome?
Yes, of course. We need to know a lot more about this syndrome and what it means as we make our decision about schools, unquestionably, Andrew. Again, I'm speaking as a parent and also as someone who believes the most important role I play is to protect people's health and safety, and particularly our families, our children. I'm very, very concerned. So yes, that information will absolutely be factored into any decision we make. The question of the timing, we communicate, our team communicates with Mike Mulgrew and the team at the UFT and also the Administrators Union, CSA, all the time. And we'll keep communicating with them. I haven't heard anyone state a particular timeline in what is obviously an ever-changing environment. So we'll have that conversation, but I say very clearly the best way to make a decision of this magnitude is when we have all the facts and when we know what it's going to take to ramp up. We will define that timeline. The Chancellor will define that timeline. Now, I think where everyone's on the same page is health and safety first. Plan A is unquestionably open the schools as normal because that's what's in the interest of our kids and our families. But we have to make sure kids are safe, family members are safe, educators are safe, staff is safe. We have to make sure that we are confident of that. For any reason we're not confident of that, then there's a plan B, a plan C, a plan D. You can do all sorts of things from alternating days, staggered schedules. You can just stick with the pure online learning, which is nowhere near what we'd like it to be ideally, but still has been a very, very admirable effort in reaching so many kids. But it's May, for God's sakes. This is a decision on something that's it's less than 4 months away, but not much less than 4 months away, and we will make the decision at the right time.
Last for today, we have Dave Evans from ABC 7.
Hey, Mayor, I wanted to ask you if I could just your overall view of this weekend, how things went and how things might change going forward. The things that jump out at me about social distancing from the weekend, Domino Park, it seemed to go pretty well. Those circles, they were interesting. I think we counted more than 6 people in some of the circles. Then also, I think that restaurant in Chinatown that was serving takeout and drinks, people seemed to congregate outside without masks. Those things jump out at me, but I just wanted to see your overall view of how things went since we did have such a nice weekend, and moving forward, if things are going to be changing with police enforcement or, social distancing ambassador enforcement.
Sure. Great question, Dave, and I appreciate it. So, sort of try and pull it all together. First of all, the educational efforts, the exhortation, the reminders from the ambassadors, which now number well over 2,000 city employees, the community organizations, the faith organizations. There's more and more we'll be announcing as we go along, but there's going to be just thousands and thousands of people out in organized fashion, giving out free face coverings, reminding people the right thing to do. A lot of times people just need the reminder. The story here this weekend and every weekend is the vast majority of New Yorkers are doing the right thing. It's been unbelievable. Vast majority of New Yorkers go out for a period of time, get back home. They're staying home because they're hearing the message it's the right thing to do, Dave, and it's the right thing for everyone else, but also people are staying home to protect themselves and their families. Vast majority of people are practicing social distancing. It's not always easy, but they're doing it really well. Vast majority of people are wearing face coverings. I want to see better. I want to see more. That's why we're going to give out millions and millions of face coverings. Look, I think it's fair to say we've got some individuals who still haven't gotten the message. And it's a very small number in the scheme of things of a city of 8.6 million people. But for those who haven't gotten the message, then that's where enforcement comes in. So for businesses, we heard yesterday some businesses are maybe trying to cheat and do eat-in dining. We're going to crack down on that immediately. If we see it, they're asking for serious fines, and if we see it repeatedly, they're asking to be shut down. Won't hesitate for a moment on that. The Sheriff's Office, Department of Buildings, NYPD, FDNY, we have a lot of enforcement we can bring to bear on that. But that, we are not seeing anything but some stray reports so far. The issue with the bars, Dave, it's just common sense here. Don't congregate. What did I say about the NYPD? The NYPD is not going to give summonses on face coverings. It will give out free face coverings. It will give reminders. It won't give summonses. Won't give summonses if a few people are too close together. It will remind them to create space. But if you've got gatherings, anytime you see gatherings, it's real simple. NYPD, sheriff, any enforcement entity is going to come up and say, immediately disperse, and if they don't disperse, then summonses begin. So for all those folks in the bars, like, just don't even think about it. You want to go drink, get your drink, go home. But do not allow gatherings to occur because it's not safe. It's just not safe. And you're gonna, do you want to restart this virus growth in this city? Do you want to make everyone less healthy? Do you want to have us all locked up for longer? Anytime people are doing that, that's what they're contributing to, unfortunately. So let's just get it right. This virus won't go on forever. It's for a period of time, but if we're going to beat it, we have to be tough and we have to be disciplined. That's what most people are doing. And the circles, look, Dave, the circles in Domino Park, it's an experiment to see if it's the kind of thing that'll work. Generally, what we saw is the efforts to reduce the number of people going into some tight spaces had some real success the first time we're trying it. But we're going to keep experimenting to get it right. And I want to thank all the folks who are out there, Parks Department, NYPD, all the ambassadors. They're out there very, very diligently out there helping people. I was with a great group of Parks Department and DEP and DOT workers in Flushing Meadow Park on Saturday, and we were giving out face coverings. And they're really into it. They're really into protecting people's health and doing something good for them. And the folks we came across, were grateful to get free face coverings. So we're going to do a whole lot of that. And I think it's going to add up. And just to all members of the media, anytime you've got a report of a place where there's gatherings that are not being addressed, or a restaurant that's trying to serve food in or anything like that, please let us know and we will go pay them a very immediate visit to address the problem. Okay, everyone, to conclude. Look, over the years you've heard the very wonderful phrase, made in New York. And there's things we're known for, and things we're famous for, and things we make that people admire all over the world. But there's a whole lot of things we didn't make because we didn't think we had to. And for years, there was no reason to make certain medical supplies and medical equipment that was made somewhere else, and we could get it when we needed it. But the world changed, and it changed very, very suddenly. And the things that we thought we could depend on weren't there anymore. What did New Yorkers do? Our backs were against the wall. Could have crumbled under the pressure. We could have said, oh, geez, there's nothing we know how to do. What are we going to do? We don't know how to make that. Instead, New Yorkers did the exact opposite. New York companies stepped up. New York experts, inventors, scientists, people stepped up and they found a way. And this is the best of New York City. We always find a way. Always find a way to make something happen. And that is an indomitable spirit. It's actually a very beautiful thing. And there's a reason why this place is filled with talented people and people with so much drive and energy. People like that have been born and raised here for generations, and this place has attracted people with those skills and talents from around the world for generations. You add that all together, there's no place that could better fight back this pandemic than this city, and you're proving it every day. But I really want to just tip my cap to all the people who said, we're going to do something here no matter what. And we're going to build something, whether we know how to do it or not, we're going to figure it out. And lo and behold, they did. And now the medical supplies and medical equipment being built right here in this city is protecting your life, the life of members of your family, protecting our first responders, protecting our healthcare heroes. It's actually a very, very moving and beautiful story. This is how we win. Thank you, everybody.
Please sit down. Get things done. Nobody gets it done like we do. Now, I don't know, are we letting the media in? Is the media here? I guess we have a limited media because of distancing. And some people think I did that on purpose. But we've been getting along with them reasonably well lately. I just want to thank you all for coming back, because you came back. This is a Republican group, largely, if not in all cases. They look pretty Republican. I'm not sure about Devin. Let's just, you're a Republican, aren't you? This is a very, very Republican group, and we appreciate you coming back. Hi, Debbie. And I just want to say a few words, and maybe we'll say a couple of words in front of the media. We just left the most beautiful ceremony celebrating 75 years, the 75 years, and it was magnificent. It was beautiful. It was windy and beautiful, and we have a great country, and we're rebuilding our country. We had the greatest economy in the history of the world. No country had anywhere near us. And we had the best we've ever had, but we've had the best ever in the world. China is a very good competitor, but we were doing much better than China, and that's before COVID, before this plague came in. We were doing much, much better than anybody, best we've ever done, and we had to close it down. It was an artificial closing. We had to just close it down. Never happened, a thing like that never happened before. We did the right thing. It's horrible what's happened. It should have been stopped. It should have been stopped where it came from, which was China. It could have been stopped easily and quickly, and for some reason they were unable to do it. I think they tried, but it got away from them, I guess. But it's a shame, and so many hundreds of thousands of people around the world have been killed, 184 countries. But we're going to build our country back, and we're going to build it back fast. This group of people, we all did it before, and we'll do it again. We created something that has never been seen before. And if you are somebody that likes history, and I think everyone in this room likes history, you wouldn't be doing what you're doing. You would see that, and you would remember that this was the year that China was going to overtake us in the economy. If you go back 2 months, you would see that they weren't anywhere close, that we were going to be there many years of if the right person sits in this seat, it'll never happen. If the wrong person sits in this seat, it'll happen in a period of a few years or less. It can happen almost immediately. So we are in a position where we have to start all over again, and we will start all over again, and we'll build something that was even better than we had before, recognizing that so many people have died. So many people have died. That's the one thing we can't do anything about, unfortunately. What I can say is if we did it the different way, if we went herd, if we just said, let's wing it, we would have been talking about numbers that would have been unsustainable and unacceptable. You look on the screens, you look on television today, and you see body bags, and you see mass graves, and we may be talking about 95,000 people ultimately. We may be talking about something more than that. But if you take a low number, 1.5 million, so you multiply whatever number we're talking about times 15, it would not be acceptable. It would not. It's not acceptable now. One person isn't acceptable, let alone perhaps 100,000. So we're going to rebuild it. We're going to rebuild it back as fast as we can. I think we're going to have an incredible transition, but transition leads to fourth quarter. Third quarter, I call it transition. We'll start to see it. It's already happening. People want to come back. I think everybody in this room realizes we have to come back. Otherwise, you have a broken country. You'll never be able to do it again. You'll never be able to build this miracle. It's a miracle what we did, what all of us did, and what many people before us did. You'll never be able to build it again. The people want to come back. You see what's going on at state houses all over the country. They want to come back. I think some people don't want it really to come back for political reasons, which is sick. But the people, the real people, the people that want this country to be great and great again, we can say, they want to get back. And we're going to have embers, we're going to have fires, we're going to have things to put out, and we'll put them out. We learned a lot, things that we had no idea 2 months ago. We've learned a lot over the last couple of months, and we're going to do a job like nobody's seen before. And I spoke with Angela Merkel today. I spoke with Prime Minister Abe of Japan. I spoke with many of the leaders over the last 4 or 5 days. And so many of them, almost all of them, I would say all of them, not everybody would want to admit it, but they all view us as the world leader, and they're following us. You look at what we've done with ventilators. We started, we had no ventilators. Nobody thought in terms of a ventilator. It's like, and I say it all the time, it's like building a car, and other countries don't have ventilators. And we became so successful at ventilators and building this very complex machine, very expensive machine, but very, very complex to have it right, to do it right. Highly computerized, very technologically significant. So we built, and we built, and we built. And they took other factories for totally other purposes, and now we have 9 factories that are throwing out ventilators at numbers that nobody can believe. It was really, there's not been anything like that since the Second World War, where we did the same thing with other types of product. And we're giving thousands and thousands away to other countries that are people dying because they don't have ventilators and they're not equipped to do what we did. So we're giving thousands and thousands of these ventilators away to many countries that have suffered greatly. Italy, France, Spain, so many countries. And Nigeria called. Tremendous problems in Nigeria. Tremendous problems all over. And so they're very happy. In addition to that, we're building stockpiles for ourselves. So if this disaster ever happens again, we have plenty. Some of the governors, we're working along great with almost all of the governors, but some of them, they needed ventilators. Now it's testing, and we have testing at a level that nobody's ever done before. Every leader tells us the same thing. In fact, they want to know, what are we doing? But you don't hear that from the media. You never hear that. But what's happened with testing is incredible. So as of this morning, we've done 8.5 million tests. And yesterday alone, in one day, we did 300,000 tests. And that's an incredible tribute. And now they have the test where it takes you 5 minutes. That was a test that didn't even exist. Everything had to go to a lab. It would be sent to the lab, so it takes a day, and then it takes another day. But it takes you 3, 4, 5 days if they do a good job. Now you do a test, boom, and you have it in 5 minutes, and nobody ever thought a thing like that was even possible. That's the Abbott laboratories, but now we have other competitive tests even with that. So what we've done has been incredible. We're going to continue to do it. We're going into transition, and I call it transition to greatness. It's going to be transition to greatness, because we're going to do something very fast, and we're going to have a phenomenal year next year. Third quarter transition, fourth quarter is going to be good. There's tremendous pent-up demand, and next year we're going to have a phenomenal year. And with that, I think maybe I'd like to go around the room, and you could introduce yourself and say a few words, and then after that, the media will leave, and we'll have some discussions among ourselves, okay? Please, why don't we start? I think I know this gentleman, huh? And by the way, Kevin has done some job. He should have had the job a long time before he had it. But that's okay. We have a great man, and he's going to be, hopefully, a great Speaker of the House. We got to get him there. If we get him there, and when I say hopefully we're going to win, because I have no doubt he'll be a great Speaker of the House. We don't have to hope about anything. He's done a fantastic job. Kevin?
Well, Mr. President, I do want to say one thing. As you and the First Lady were out there honoring what transpired 75 years ago, that we had to end the tyranny of what Hitler was doing throughout Europe. We now battle something that is like a war. That this is a virus that came from a distant land that we did not invite. But just as we had to transform our country then and unite, that leadership you're providing is doing just that. As you talk about ventilators, gearing up, testing, more than 1.7 million in 1 week. The ingenuity of this country will solve this problem. And we will not just solve and get a vaccine for us, but for the rest of the world. I do want to thank you, coming from California. I know I have a blue state, I know I have a governor, but the way you've worked together, watching you send those Navy ships to New York and to California, build those hospitals in a time of need, I do want to thank you on behalf of everyone in California.
Thank you very much. Great state. Thank you very much. Elise?
I think they'll turn it on.
Thank you, Mr. President, for all of the support for New York State. This has been a true partnership, and the administration has stepped up, whether it's ventilators or building the Javits Center, which was tremendously important. My district in upstate New York, people are eager to get back to work safely. Our tourist businesses, our hotels have been devastated. So as we talk about this transition, making sure that we allow our small businesses to get back to work safely is so incredibly important. Also, our farmers. Thank you to Secretary Perdue for stepping up. We have dairy farmers in our district who are going through a crisis, but we know that you support the farmers, and we're appreciative of all of your work for New York. And I know you've worked effectively with Democrats and Republicans in New York State, so thank you.
Thank you very much. And so for the farmers, you know, we gave $12 billion 2 years ago from China through tariffs because they were targeting our farmers. And then we gave $16 billion, and this year we're giving $19 billion to the farmers. And that's more money than they've ever even thought about. And it's keeping them in a position where, really a position of strength, but they deserve it, what they've gone through for 18, 19 years. This isn't a new phenomenon. This is for years they've been ripped off. So we're taking care of our farmers. Thank you very much, Elise.
Thank you.
Dan, please.
Oh, thank you, Mr. President. Thank you for having us here, and thank you for working every single day. You know, Speaker Pelosi would have the America believe that we can only show up to Congress to vote once every 3 weeks. Of course, that's not true. We could be working every single day, just like this administration is, and I appreciate what you've done. Appreciate working with us to protect our energy industry. You know, America is in real dire straits with oil prices the way they are. We're deeply worried about that in Texas, and your administration's been excellent to work with on that front. We understand how important energy independence is to our nation. Texas is reopening, and I think it can be a model for the rest of the country as we step out of retreat and move to actually confront this virus head on and get people back to work.
Well, it's interesting, Dan, because oil prices are now going up and gasoline prices are going down. That's like the best combination I've ever heard. So our millions of people in the energy business, I think, is going to be, you know, that's moving up. But you look at those gasoline prices and they're really coming down. So I don't think I've ever seen a combination like that. It's going to be very good. A lot of good things happening in energy. Jared, you should say something because you headed up our whole ventilator problem that this country had. The cupboard was bare when we took it over. People don't realize it, they don't want to say it, but the cupboard was bare, that we had nothing. And I could say that for the military too. Dan would know that almost better than anybody, and the folks that are so much and so well versed on military, but our military cupboard was bare also. We had obsolete equipment, we had old equipment, and now we have we've never been in a position like this. We have the best equipment in the world, all made in the United States. But Jared, why don't you give a little talk on what we did with the ventilators and how that just became such an incredible story. And we're doing the same thing with testing, and we're pretty close to a point where we're equally as good. Go ahead.
Yes, sir. On ventilators now, the good news is that every day the balance that we have in the stockpile that the country has continues to grow. Initially, it was very scary in that we had a lot of states requesting numbers that could not be supplied, and a lot of you were very helpful at getting the local hospitals in your districts to give the actual data to the federal government, because the president wanted to make sure that anybody in this country who needed a ventilator would get a ventilator. He saw what was happening in Italy, where people were dying in hospitals and not able to get the care they needed, and the president said, I don't want that to happen in America. Deploy every resource that we have, get all the intel we have, and let's do our best to try to make it work. And we were able to make it work thanks to your leadership. And then what we were also able to do is use the Defense Production Act at the president's urging, and we were able to contract 11 different ventilator companies. Last year, America made about 30,000 ventilators. This year, we'll make about 150,000 in a 4-month period. And so we're in a place right now where we're doing well. A lot of our allies, the countries that are friendly with America, are starting to get ventilators from us, and we have more than enough to take care of all the American citizens. So it's been a great success story. And on testing, the numbers continue to grow. We have all the supplies that we need to do it. We've now educated all the governors. We have over 5,000 testing machines in the city. We've had the commercial sector through the public-private partnerships that the president had us lead. Those have now identified over 5,000 machines. We've done DPA on swabs, so we're making a ton of swabs. We have reagents. We have transport media. We've been working with all the governors to help them with the National Guard on how to better collect samples. And so we're seeing those numbers starting to really rise. And when you look at the number that America's done relative to any other country, we're 2 to 3 times the next number. So on an absolute basis, the job that you've led on that has been absolutely tremendous, and that's giving the tools to America to start opening up these counties and allowing Americans to get back to work.
Thank you, Jared. You've done a great job. Someday people are going to appreciate it. They say, oh, he's a relation. Well, he's a relation. If he wasn't a good relation, I'd get him out of here so fast. Sometimes we have a problem, Louis. I say, get Jared on it. Great job, Jared.
Thank you.
Smart guy. So here's another smart guy. So Devin, I thought about Devin more over the last couple of days than anybody else, because this guy would come in and he'd tell people what was going on, and nobody believed it because it was not believable. It wasn't true that they would be doing a takeover of a presidency illegally and all of the illegality that was going on. And he was the first one, our superstar Jim, and all of us will admit this guy was just, he wouldn't stop. Devin Nunes, he wouldn't stop. He saw it before anybody, and you deserve a medal. You deserve the equivalent of Pulitzer Prizes. They ought to take the Pulitzer Prize away from all of these phony journalists that got a Pulitzer Prize, and they were wrong. They were wrong on everything, and now they've been proven wrong. I saw where Clapper, not a smart guy. How do you have not a smart person heading up intelligence? How does that work, right? You have a man who is not smart, and he heads up intelligence, and that's possibly what happened. They ran away with it, but he knew what was going on, and I'd watch him on television. He'd say the worst things. And now I know why Shifty Schiff, dishonest, corrupt politician, why this guy didn't want these papers exposed. Because all these people said under oath, where they go to jail if they lie, they were totally, no, I didn't see any collusion with Russia. I saw nothing. No, I said, but he was on television before and after saying there was massive collusion, like Putin was my best friend. We had no calls to Russia. We had no calls from Russia for years. And all of a sudden, we have this great friendship. And by the way, getting along with Russia is a great thing. Getting along with Putin and Russia is a great thing. And stuff like this makes it impossible. And that leads to very bad things, very bad things. But I have to say that Devin was incredible. He understood it. He understood that it was a hoax before anybody else knew what was happening. And then I have to say, the people in this room took over and did a hell of a job with you, right? They had guts. They had guts like nobody's ever seen before. I want to thank you on behalf of our country, and I'd like to have you say a few words.
Well, thank you, Mr. President, and it's unfortunate what you had to live through for the last 4 years.
Yeah.
From your campaign to your presidency, and I appreciate your kind words, and for all the folks in here who worked so hard getting to the bottom of the Russia hoax situation. Let me just talk a little bit about the situation our country's in now. I know you're well aware. We've had 6-7 weeks here of keeping people inside their homes. We've learned a lot about this virus. There's still a lot more we need to learn. We need to learn what our friends over in Asia were doing at the time that this virus was taking off, and the issues with the World Health Organization. And I believe with your new pick, with John Ratcliffe, member of the House Intelligence Committee, member from Texas, he's going to do a great job getting to the bottom of this, and I think leading the intelligence agencies through what have been some pretty dark times over the last few years.
And I think we should say Rick Grinnell has done a great job, too. In fact, John Ratcliffe called up 2 days ago. He said, I'm really looking forward to this, but I don't know if I can top the guy we have in there right now. And he was he's going to do a phenomenal job, but Rick Grinnell has been incredible. Before that, we had an empty seat. But Rick Grinnell, what he's done, even Louis would admit that. And I saw Rick yesterday walking in with thousands of pages of paper into the Justice Department. We didn't see that before, did we, Louis? Huh? Rick Grinnell did a great job, and John is going to be phenomenal. Please.
Well, Mr. President, what we expect, and the American people expect, is transparency from our law enforcement agencies, and I think we're well on our way to getting that. I want to also thank you for bringing us back here to show the American people that we can be here and do our work. The Democrats are cowering at home right now. And it makes no sense because we've learned so much. I can understand for the first few weeks, but we're learning. We have ventilators. We're learning new ways how to treat this virus. And if we're expecting, as you know, you've been in my district. It's the San Joaquin Valley of California, heavy agricultural area. My folks have been going to work. My folks have been going to work, and because they have to feed this country along with a lot of the folks around here. And if we expect the guys that are cutting meat or working at a grocery store, working in these packing plants, if we expect them to go to work, we ought to go to work as members of Congress. And I'll just leave it at that.
I will say I got you all of your permits necessary from the federal government for water. You know, we throw millions of gallons a day of water into the Pacific Ocean that comes from up north. And when I saw Devon, I say, how come those fields are all barren? They're beautiful land, all barren, brown. And then they'll have a little patch like this, a little patch in a corner or a little patch on one side. And it's beautiful green. You could see it was so, and I said, how come so much of it, 90%, 95%, it looks like a desert, and you have this. He said, we don't have water. I said, you mean you have a drought? This was a long time ago we met, right? Right at the beginning, before I got elected. And I said, you mean you have a drought? He said, no, we don't have a drought. We send millions of gallons of water out to the ocean to protect a very, well, I'll never say anything's unimportant. I think everything's important. To protect, go ahead, what's the name?
The smelt, Delta smelt. Yeah.
So you have a Delta smelt that's not doing well. It's getting no water, and it will do a lot better if it had water. But they send millions and millions of it. Is that seriously, is that the only reason? That's the reason they send it out there?
Yeah, that and,
for the Delta
that and salmon, yes.
It's
so
incredible.
The farmers are very thankful for recognizing the important work that you've done, not only in San Joaquin Valley, but all over the country. And I'll just say that's why they're out working, and I think we should be working. And I'm
well, you know,
brought us here.
with the water, though, I said, so what has to happen? Well, you need approvals from Congress, from this, from you need all sorts of approvals, but you need it from Commerce more importantly than anything. I got every approval for you, and you got a lot of the state approvals done through Kevin and yourself and others. All you need now is the signature of the governor, and those millions of gallons of wasted water going into the Pacific, that's like a drop in the bucket, doesn't mean anything to the Pacific. All of that water would come right down all the way into Los Angeles. And you know, in Los Angeles, I had a house in Los Angeles, I sold it. You know why I sold it? Because Secret Service says you can't come here anymore. I said, I might as well sell it. But I had a house and you couldn't have water. You couldn't water your grass. They said, oh, you're not allowed to water your grass. And then you look at this massive turn. They had a turn. It takes a day to turn it, like a big faucet. And they turn it, and it veers all the water out into the Pacific. It's crazy. So we're all set, except you need Gavin's signature. If you get Gavin's signature, you're going to have water from Los Angeles all the way up. Yeah. And it's the most incredible thing I've ever seen. I thought it was a drought. I said, he said, no, we have tremendous amounts of water, but we send it out to the Pacific Ocean. And it was over the smelt. So if you can get his signature.
Well, I know you know, during this time of crisis, we need to work with the governor, and I thank you for working with our governor, who's obviously not a supporter of yours. But there is a serious issue there that the governor needs to recognize that we have a water crisis in our state that you've recognized, and he needs to drop the lawsuits that he's brought and work with us.
Well, we've gotten along very well, Gavin Newsom. We've gotten very well with regard to COVID-19, as we call it. In that respect, he's been fantastic, and we've been fantastic, and he said very generous things. But on other things, we disagree, like the water, like cars, because you can have a car for much less money that's equally good environmentally, but much safer, better car. California forces you to build a bad car that doesn't work well. And there are a lot of reasons for not doing it that way. So we'll end up. So on that we don't agree, but we agree on the coronavirus, and on that we've gotten along very well. And we've done a great job for California and for everybody. And he was very honest about that assessment. It would be great if you could get the water, but you're all set. Okay, you're all set. Just I say that to Kevin too. get his signature, and you're going to have so many, all those thousands of acres are going to be opened up, and they'll have plenty of water for Los Angeles too. So they won't have to ration. They're going to ration the water in California. It's the most incredible thing I've ever seen, and yet they're sending millions of gallons out. So thank you very much, but thank you very much for the job you've done. Appreciate it.
Thank you, sir.
Please.
Ted Budd, North Carolina.
Yes.
I want to thank you for having me here. I also want to thank my colleagues from the House. There is no vote today. There's nothing we're voting on. The Speaker Pelosi has not brought us in to do anything meaningful, but we're here to lead by example and to say that we're ready to work. So we need something meaningful to help those back home. In North Carolina, we're very grateful for all the work that you've done here. And again, Secretary Mnuchin, I want to thank you as well for all that you've done. The PPP and the work that you've done for Main Street has helped keep these businesses intact so that we can have this quick recovery. We're ready for Q3. We're ready to get going. In North Carolina, we're ready to rebuild.
Great job.
Thank you.
Thank you, Mr. President. Guy Reckenthaler from Pennsylvania. I just want to thank you and the administration for holding China accountable. I think for way too long, no one's held China accountable. And the fact that we're looking into the World Health Organization and how they really worked hand in glove with the Chinese Communist Party to cover this virus up in the early days is absolutely shameful. So thank you for bringing attention to that. In Pennsylvania, we're having a really hard time because the governor has had such draconian shutdown measures. We're now #1 in unemployment claims, but we're only #5 in terms of population. Instead of protecting the most vulnerable in nursing homes, where you had 65% of the deaths, if not more, in Pennsylvania, he just had a draconian measure, one-size-fits-all approach that lacked any kind of nuance, and it's destroying our economy while at the same time leaving the most vulnerable exposed to this virus. So thanks for calling out the governors that are going too far with this and calling for America and Congress to go back to work.
So what the Democrats are doing in Pennsylvania is a disgrace, okay? It's a disgrace. Thank you very much.
Thank you.
Mr. President, Mark Green from Tennessee. Great to see you again.
Thanks, Mark.
Thanks for your leadership. This COVID-19 thing has been unprecedented. It's a challenge to both the world and the United States, our country. A challenge made worse by China and the delays in information to us, the deception. I mean, China lied and people died. And as an infantry officer, an ER physician, former business CEO, I know that when a leader is caught in an ambush, that leader has to make split-second decisions with the information that they have. Mr. President, I'm proud of the decisions that you have made. Decisions like banning travel from China, which these guys all laughed at and criticized, but it saved American lives. Sir, you saved American lives with those decisions. And we in Tennessee, we thank you for that. We're opened up for business. We're going to the restaurants and business is running again. We're ready to lead, and we appreciate your phased plan. We're implementing it in Tennessee. Just thank you for your leadership, sir.
I really appreciate it, and your governor is doing a great job. And you're right, we banned people from China coming in, and they said, oh, but you did allow people. Yeah, they were American citizens, and they were allowed in under very, very strict rules and regulations and quarantines and everything else. But we banned people, and a number of our leading doctors said that saved hundreds of thousands of lives, and that was in January. And I remember being in a room with, I think, 21 people, and I was the only one that wanted to do that. Nobody else wanted to do it. They thought it was crazy. It had never been done before. Nothing like that had ever been done before. And now you watch them, the Democrats and the media, say, oh, I should have done it sooner. Nobody even thought about it. And a month later, you'd see Nancy Pelosi and other people talking about this disease is just nothing, it's going to spread over. And she wanted to go, and she was actually late in February, she was in Chinatown in San Francisco celebrating because this disease is going to be nothing. So I understand that. I mean, she felt that, and I can understand it. But for them to say much earlier, I actually banned China from coming into our country. It's just such a political disgrace that they're able to get away. It's just like Shifty Schiff making the statement today to try and save face when we have him cold on the papers, on the documents, and in about 19 different ways. It's so bad and so sad for our country. Thank you very much, Mark.
Mr. President, you put that ban in place before they even named the virus.
Yeah.
You saved Americans' lives. Thank you.
Thank you very much. I appreciate it.
Thank you, Mr. President. Kelly Armstrong from North Dakota. We're an ag and energy state, so we've been uniquely hit on a lot of this stuff, but I'd like to say thank you for standing so tough with Saudi Arabia. That was a huge deal for our oil producers. Obviously, you've been great for agriculture, but thank you especially for your statement yesterday in support of cattle ranchers. Sometimes they get lost in the mix, and they've been getting hit pretty hard right now, so we really appreciate that. And then just, you get this economy up and going, and we'll do what we do best, and that's feed and fuel the world.
And that demand is coming back, and you're up to $25, $26 a barrel, and a little bit more, and you're going to save your energy industry, really, because we're number one. And Russia and Saudi Arabia, I got them together, and they came to a good conclusion for us and for them and for everybody. And once that demand goes up, it's going to be great for the energy industry. So thank you very much.
Thank you, sir.
Louis?
Thank you, Mr. President. And echoing the thanks, if you had lost that election in 2016, we would never have been energy independent. And it's been great for Texas. It's been great for America. And I do want to advise our media friends before they write stories about how we didn't wear masks and we didn't possibly socially distance adequately, that you saw to it that we had tests and that nobody in here has the coronavirus unless it's somebody in the media. So the only reason we would wear masks is if we were trying to protect ourselves from you in the media, and we're not scared of you. So that's why we can be here like this. So thank you for amazing job you've done. And it is amazing to see the hypocrisy. You do a travel ban, like Mark said, it saved lives. And they called you racist. And then when they realized you did the right thing, they said you should have done it earlier. And perhaps they could have noticed the need if they had not been pursuing, the hoax that was the impeachment. And I know the Speaker has appointed this new committee to investigate your handling of the coronavirus. And I've suggested they ought to name that committee the Committee of Oligarchs to Unelect the President, or coup for short. But that's exactly what it is. And the money, Steve and Larry, thank you for your work. There are a lot of people that are working for companies today that would not be in my district in East Texas, and they wouldn't be. I've heard this week from some that say they're getting threats that if they had any capital, they shouldn't have taken the loan, and they may be pursued for criminal when they could not have hired those people back if they had not taken the loan. So right. I hope that that'll be backed off a little bit, because it has put people to work that couldn't otherwise. But I'm optimistic, and I wouldn't be if you weren't president. So thank you for the work you're doing.
Thank you, Louis, and you've been a great help. And if we didn't win the election, we wouldn't have found out all of the corrupt practices that are taking place at the top of the FBI with dirty cops and all of the things that we found out about other people in other agencies that are equally as important. All of this, we went on Drain the Swamp, and that's what we're doing. But nobody ever told me the swamp was going to be this vicious or this deep. And we're doing it.
Could I make a suggestion on the justice area? And I know that with the Democrats in charge, some of the most important reforms may not happen, but the FBI is the only law enforcement entity I'm aware of that has not even come into the 20th century, not even asking them to come into the 21st. Everybody else does videotapes and audio tapes, and the